Through the Digital Regions Initiative, Barwon Health and its project partners have funded the cdmNet project. The development of cdmNet has improved the delivery of chronic disease management services by enabling patients, general practitioners, specialists and other health professionals to collaborate on a patient's healthcare plan. This broadband-based system works to transform the way in which chronic disease is managed. cdmNet has been successfully integrated into regional, rural and remote areas of Tasmania, Western Australia, Queensland and Victoria. It automates the entire care management process, from the creation of individualised care plans to review and follow-up, continuously monitoring the care of the patient in real time across the whole care team.
cdmNet stands for Chronic Disease Management Network. The management of aged care, chronic illness, requires long-term management of the patient, regular follow-up and review, and requires collaboration across a whole care team. Currently in Australia, about a quarter of the people who should be on a care plan are on it. The worst number is that only 20% of those care plans are ever followed up and reviewed.
Barwon Health became involved in the Digital Regions Initiative programme because we'd already trialled cdmNet for a couple of years prior to that, and we'd seen some really significant benefits accruing for our patients and for our community. We've seen huge changes in service provision, so we have now 5,000 people in the community on these care plans, and now they're managed against a plan that's actually followed through. Previously the plans sat in drawers and not really followed through. They're a more bureaucratic mechanism, whereas now they're an actual tool in managing the health outcomes for these individuals.
We use cdmNet referral system for our chronic disease management patients, referring them onto allied health workers such as podiatrists, dietitians, diabetic services.
The positive impacts to my patients have been that the reminders on their telephone, that most of them, as soon as they get a reminder on their telephone that their whatever's due, like their bloods or their whatever checkup they may need is due, they will make an appointment. We can get on the phone and make an appointment, so therefore nothing's missed.
Before, I never knew who my patients saw. I never got a phone call, I never got any sort of follow-up. Occasionally there would be a letter from a physio, but that's about all. Now I get follow-ups from podiatrists. Nearly all the allied health professions I've referred patients to, I get follow-up.
cdmNet has proved to be really useful in addressing a lot of the challenges. Traditionally you get a referral which might have the condition that I would be treating, but it wouldn't have anything about the coexisting problems. With cdmNet you can get the client's file up, you can see exactly who's involved. You can also see that there might be some comorbidities that are going to affect what you're doing, and I think it helps people all be on track and just being aware of the other challenges they face apart from what you're specifically focusing on.
Accessing healthcare plans online on a computer or on an internet-enabled mobile phone has granted patients ease of access to vital information regarding their treatment and their healthcare team, anywhere and at any time.
The aim of cdmNet was to try and provide a technology or a service over the internet that makes that collaboration and that follow-up very easy for the doctors, very easy for their care team, and very easy for the patient.
The cdmNet addresses the problems with chronic disease management because of the reviews. That's the thing I like the best. It really helps me to take care of the follow-up plans and follow-up treatments so we can change it or leave it the same.
It's a really, really efficient way of monitoring clients.
It's a really good way of sharing information.